Hey, Dr. David Schiller here, and today we're going to be talking about the difference between a relief program versus a corrective program. Now, ultimately, as a patient, you have the choice of either. I can't force you to do anything. I can only show you what the difference is between the two, and then you make that decision. I'm always going to be encouraging people to try to correct their problems and not just patch them up. I have numerous posts on the difference between symptoms versus function and the relationship of those two things to your health. But the idea is that there is a difference between the two. A relief program would be the number of visits necessary just to get rid of symptoms. So if you remember from our previous post about function and health, the brain and the body are connected. There's this neurological integration that's supposed to be occurring, and if the brain controls everything, then if there's interferences on this communication system, where there's subluxation or blockages or interferences along the nerve pathways, if they're in the spine, we call them subluxation because the vertebrae are not moving appropriately, so as a result, the communication starts breaking down. So if the brain's controlling bodily function to keep it healthy, now that there's subluxations and blockages, then that interference is going to cause the malfunction, and now no longer are you functioning at 100%, so therefore you're no longer healthy. So the malfunction, as a result, one of your body's functions is to repair tissue. Every year or a few years or every few months, there's turnover of tissue where you have whole new body parts replacing old body parts into new body parts. So as a result, if there's malfunction going on and the body's supposed to be healing and replacing old tissue with new tissue that's more healthy, if it's a malfunction, there's going to be an accumulation of damaged tissue. As a result of an accumulation of damaged tissue, that's where these symptoms come from. So the number of visits necessary, or the amount of care necessary just to get you feeling better, that's symptom or relief care. It could be one visit where you start feeling better, or it could be a few weeks of visits before you start feeling better. Full relief may take weeks to months, but we hope to get you starting feeling better very, very soon. The amount of care necessary to not only get rid of symptoms, but to actually try to reverse the process back and reverse this malfunctioning process back to health is what is called correction. Correction would be the number of visits necessary to get your body functioning better again. How do we know if that's happening? That is by monitoring the testing that we did originally. When those tests normalize, then the person is correcting. As a result of the correction, do you then want to maintain? Maintaining the correction is what allows you not to go back to where you were in the first place. So maintenance is crucial also. So there's no use correcting if you're not going to be maintaining. Maintenance care or wellness care is another term for what people may call preventive care, but prevention is different than maintenance, and wellness is different than prevention, and maintenance is the first step. But you eventually want to get into a wellness program where you're not only just preventing problems from happening, you're actually going into the better stages of health. And I have other posts on that topic also. So relief would be the number of visits necessary just to get you feel better. Correction would be the number of visits or the amount of care necessary to get your body stabilized so the problem is less likely to come back, reversing this process back to a more functioning or healthy state. So I'd like to thank you for watching, and I'll see you soon.